good morning. I'm Rima Stanley, tutor at M College of Nursing, Department of Mental Health. In this video, I'll be discussing with you about nurses' responsibility for patient receiving anti-Parkinsonian agent, mainly Trihexy Phenodihydrochloride and drugs used in child psychiatry. Anti-Parkinsonian agents are drugs which are used for the treatment of medication-induced movement disorders, mainly neuroleptic-induced Parkinsonism, acute dystonia, and medication-induced tremors. These drugs include anticholinergics, mainly Trihexy Phenodihydrochloride, benztropine, and piperidine. We also have dopaminergic agents, mainly bromocriptine, carbidopa, and levodopa. Monoamine oxidase type B inhibitors, example selegiline. Now let us see a little bit in detail on trihexy phenodihydrochloride. This drug is commonly available in a trade name of Pacitin, Trihexane, and Trihexy. The indications include drug-induced Parkinsonism and management of Parkinsonism. Now let us see the nurse's responsibility. First of all, it is important to assess symptoms of Parkinsonism and extrapyramidal symptoms, as the medication needs to be tapered gradually once the side effects of antipsychotics has reduced. The patient must also be cautioned to make position changes slowly in order to minimize orthostatic hypertension. It is important to instruct the patient about frequent rinsing of mouth and maintaining good oral hygiene in order to prevent dryness of mouth. Patients should also be told that this medication can cause decrease in perspiration and sometimes overheating during hot weather. Now let us see drugs used in child psychiatry. This include clonidine and methylphenidate, which is commonly called as Ritalin. Clonidine is commonly used in Tourette's disorder, is a type of tics disorder, and for the control of aggressiveness and hyperactive behavior, also used in autism. While methylphenidate is used for attention deficit hyperactivity disorder, narcolepsy, it's a sleep disorder, depressive disorder, and obesity. Now let us see the nurse's responsibility with clonidine. It is important to monitor the patient's blood pressure because the common side effects is hypotension, and the drug should be withheld if the patient becomes hypotensive. It is also important to advise the patient for frequent mouth rinsing and also maintaining good oral hygiene to prevent dryness of mouth. Now let us see the nurse's responsibility with methylphenidate. First of all, it is important to assess the mental status of the patient for changes in mood, level of activity, degree of stimulation, and aggressiveness, as the common side effects include insomnia, nightmares, dysphoric mood, tics, and psychosis. Ensure that the patient is prevented and protected from injury, as there is a side effect such as dizziness which can cause the patient to fall. It is important to keep the environmental stimuli as quiet as possible to decrease overstimulation. The patient must be encouraged to take medication immediately after meals, mainly to decrease anorexia. It is also important to check the patient's weight regularly, at least once a week, during the hospitalization as well as while the patient is at home, as this drug has a potential side effects such as anorexia, weight loss, and temporary interruption of growth and development. In order to prevent insomnia, the medication should be administered at least 6 hours before the bedtime. It is also important as a nurse to ensure the parents are aware of the delay effects of Ritalin. The therapeutic responses with this drug may not be seen for 2 to 4 weeks, and There can be a tendency for the patient to discontinue the drug for lack of immediate results. Patients' parents should also be told to avoid over-the-counter medication. OTC drugs are medications which are used without prescription to treat minor ailments. Some OTC drugs can have symptomimetic agents which can create drug interaction that may be toxic to the child. It is also important to ensure that parents are aware that the drug should not be withdrawn abruptly, and the withdrawal of this drug should be done gradually under the direction of the doctor. So in this video, we saw the responsibilities of a nurse with trihexy phenodihydrochloride and also drugs which are used in child psychiatry. Thank you.